drops, the oxygen level decreases. There's a discharge. The brain understands, hey, you're dying. So it triggers an adrenergic discharge so that what happens? A microarousal and a breath. So every apneic event is related to what? The brain realizes that oxygen is dropping, that the heart needs to beat faster so the person can breathe. When the heart starts beating faster, there are also disordered movements. So what happens? A secondary bruxism. There is a bruxism movement after an apneic event that blocks the airways, where the oxygen drops more than it should. So what is the main cause of this bruxism? Sleep apnea. And what is the main problem that needs to be treated immediately? Sleep apnea. And what is the secondary issue? Bruxism. This typical patient who comes to your clinic doesn't know that they have bruxism. They don't connect a recurring restoration fracture, persistent sensitivity, or that muscle pain that keeps coming back. They don't associate this with the fact that they clench or grind their teeth at night or during the day. And that's where your role as a provider comes in. As a healthcare provider, not just someone who fixes isolated restorative problems for that patient. When you develop a more refined clinical eye to identify early signs of bruxism, you act preventively before tooth loss, before a rehabilitation failure, before the emotional toll of rework. This approach prepares you to welcome a second type of patient, the one who comes to you because they know you see beyond just the teeth. Now look how interesting this is. This patient came to see me for Invisalign, a completely aesthetic treatment. How many cases like this must pass through your hands every day? A slight crowding, he had no headaches, no complaints of pain, but look at what happened. At the first appointment, since I do a differential diagnosis for 100% of my patients, and I'll teach you how to do this in today's lesson, the diagnosis for this patient was mild bruxism. The score in his 360 chart, which has specific questions that lead me to a bruxism score, came out as mild. Look how interesting. Check out this circle around 213. First, the patient comes in with an aesthetic complaint. After a certain point, he starts to notice that his tooth is getting darker. And I observed this exostosis right above 213. But he had mild bruxism. Remember that he had mild bruxism? The treatment for mild bruxism is a specific treatment. Could it have been resolved? It could. But this patient's bruxism progressed. What happened to this patient? What happened with this exostosis focused on tooth 13? It's compatible with a bone response, bone growth due to dental clenching. If I don't have a 360-degree view, if I don't understand that he's clenching this tooth, it would necrose very easily. This is a fundamental point because if necrosis happens down the line and you didn't diagnose or control this patient, the first question he'll ask is, whose responsibility is it? Is it the dentist's or mine? Is it his or is it ours? It's ours. We are the professionals. He is a layperson. The ones who should have warned this patient about the problems he was presenting, that teeth clenching can cause necrosis, and educated him about this are us. We are the ones who should provide him with real treatment.